Insurance Toolkits is the premier platform for effectively quoting final expense, simplified issue term life, and Medicare Supplement policies. That's right. The intuitive underwriting software eliminates potential declines and provides accurate quoting for dozens of carriers. Medicare Supplement underwriting is one of the most difficult things we have to teach a new agent. Visit InsuranceToolKitscom to start your free 14-day trial today.
Hello, everybody. Thank you for joining us on this edition of the Insurance Gurus podcast. It is Steven Martinez, joined by my good friend, Johnny Brock. Say what's up, Johnny.
What's going on, bro?
Okay,
How
thank
you
you. So we have got something really special in store for you guys today. It's something that I've actually been really excited about, and I'm kind of jealous because I was telling Justin this years ago when I first got into the industry that I wanted to create something like this. And luckily, Justin told me to keep selling, put my head down, don't worry about it. And these guys have done what we've all been waiting for. So if you have not seen this tool, this is going to blow your mind. I know me and Johnny were just playing with it, and I was doing. Johnny's already been using it, but I was just playing with this some more. And the things that I was doing with it, Johnny was like, "Oh yeah, this is a game changer." So,
Time is money, and it saves time. So that's it. I'm teaching my new agents how to type because time is money.
Absolutely. So you guys may be familiar with their software in other industries, most likely final expense. So we've got the guys from Insurance Toolkits with us today. I have the co-founder of Insurance Toolkits, Mr. Joe Wahl. And Joe, thank you for joining us on the podcast today.
Thank you for the introduction. We really appreciate all of Justin's support in helping us get this built. To many of you, maybe you recognize us from the final expense or term side. We became last year at least the primary quoting platform of choice for a number of the nation's largest life IMOs, FFL and One Life and many others. And now we're going into the Medicare Supplement space and then the Medicare Advantage space so that we can provide people another option and hopefully one that provides more utility for all the agents out there who rely on quality software to do their job efficiently.
Absolutely, man. I think this is one of the best tools that agents have at their fingertips. So, I mean, it's going to make you the money that it costs. And it's to a lot of people's surprise, it's a lot more affordable than you would think. But we have another guest with us today. I have Mr. Chris Smith. Chris is a longtime agent, and he works right alongside Joe. He's helped him work on the back end of that final expense, and he's mostly done some final expense, but he has been helping revolutionize that into the Medicare space. So I'm going to go ahead and add Chris Smith to the podcast. Chris, thank you for joining us.
Absolutely. Yeah, I enjoyed working with Joe the last year, bringing this final expense product to the market, adding term to it, and then becoming Insurance Toolkits by adding the supplement side. And being a final expense agent for over 6 years, supplements was something brand new to me, didn't know a whole lot about it. But what I think is powerful is putting this tool in the hands of those who have never used SUP and giving them the confidence to be able to sell it. And then guys that sell it on a regular basis, being able to be more time efficient, be more accurate, and be able to place more business.
Yeah, absolutely. So if you guys haven't already figured out what we're talking about Insurance Toolkit. So this is a underwriting quoting tool, right? It's just a resource center. And so if you haven't seen it already, like I said, head over to InsuranceToolKits.com. That's Insurance Toolkits with an S on the end of it.com. And don't sign up just yet, because we are about to get into some of this. We're going to have Joe walk us through some of it, show us the power of this tool and how it can be utilized and how it can make you such, a much more efficient agent, like Johnny was just saying.
100%.
So Joe,
Yep.
How long has Insurance Toolkits, been around from the get-go? Because I know I've heard of it since I've been in the industry, but again, it's been a lot on the final expense side. So exactly how long have you guys been in the game?
We started it in December of 2019, and we took the year of 2020 to build the platform on the final expense and term side. And we officially launched it on the 1st of January of 2021. So throughout those 2 years, we did a lot of testing, and agents like, Chris, he won't tell everyone this, but he writes $400,000 of final expense a year. So we built all the data sets and how the software works based on agents who actually sell it. And now that we're doing MedSup, that's why we're working with people like Justin, Chris is going out and writing Medicare supplements on his own. He just, wrote one the other day when he's only done Advantage for many years. So we'd like to make sure our software is not built by anyone else than active agents selling the actual insurance, because nobody knows the products like people actually selling them.
That's right. And another thing I think is really unique about you guys is that you do accept all the feedback. There's other platforms out there that you will never get anything accomplished trying to reach out to them. But with you guys, anything we've ever mentioned, like, hey, this could be a little bit better, or could you consider doing something like this? Joe's always taken into consideration, and they've always tweaked it, and the developers have always got it done. So, kudos to you guys for that, because again, there's a lot of platforms out there that you just get no response from. And so you guys being willing to take that information, like you said, the agent knows best. So you want to listen to your people that are using it day in and day out.
Yep. Yeah. And that's something I'll show when my screen comes up. But the live chat system, an agent can send us a message. We're on 7 days a week, even later than 5 p.m. Eastern. We generally have it on until 10 o'clock. So if an agent has a question, even if it's just a product question, we're there to be able to provide assistance, myself and several other licensed agents. So we think the support side is important too, because even if you have good software, if an agent doesn't understand what they're looking at, it really doesn't matter how good the software is. So a lot of times you don't want your upline being reliant on constant questions, even if that's their job, because to a certain point, we think we should be able to, if you're paying us, we should be able to handle some of those questions for you.
Yeah, absolutely.
I got a good point to that. So my whole career, I've been blessed enough to have the Medicare professor in my next door. And
I'm Johnny's personal insurance toolkit.
He always has been. And now I don't have to bug him with it anymore. And actually, I'm happy about that, Stephen.
Yeah.
So yeah. Now, I mean, thanks guys. This is awesome. I'm excited about it.
Yeah. So I want you guys to see exactly what we're talking about, and I think the best way to demonstrate that is to let Joe, share his screen. We're going to put him in charge here and let him walk us through the system and let us know some of the bells and whistles that it has going on. So go ahead and do that now.
Okay.
Perfect.
So this is our landing page here. Some of you in the Life IMOs might access it through your own IMOs portal, but for the majority of you, especially on the Medicare side at first, it's just going to be through our site here, InsuranceToolKitscom. So I'm just going to go ahead and log into my account. And what you'll see in my account firstly is I have all 3 toolkits enabled. We do have two separate packages. So we have a Effects and Term package, MedSup only, and then combined together. No matter what you get, especially with Justin's discount code, it's more than affordable compared to other solutions out there on the market. So we try to price it fairly for everyone, while keeping in mind that we do have a full-time team of 6 people, 7 including Chris. So we try to do what we can to reinvest the money into the business to improve the product. So like we just went into, we do have the live chat support system here. So when you send a message any time of the day, you get connected with myself or several other licensed agents to help you with a question, whether it be something you're not sure about or just need clarification on. And the nice thing with our system too is it integrates between all the products. So if I wanted to run a final expense quote here, I'll just run a basic quote. And I wanted to carry this client over. Let's say I'm not going to put them all in, but we have a bunch of medications for this person, and I'm ready to compliantly, of course, go over then a Medicare supplement policy. I can very easily, I'll hit get quote again. I can save this case and then head over to the MedSup side. I can load it back in.
Oh, wow. I didn't realize. I seen that, you could save it and load it back in, but I was just thinking of the MedSup. So that's pretty cool there.
Yep. So we do have an internal way to save policies. So we do have the built-in CRM. This is not going to replace Go Guru or Go High Level, whatever you have, but we do have it here. It is HIPAA compliant so that you can, with one click, push over your client's health information. We'll just say John Smith. And when I hit save, it gets automatically pushed over to the CRM. And if I want to come back to this client, because if you're not working your book of business, somebody else is, because these people are calling in and they see ads all the time. So we really encourage our users to, if you wrote Mr. John Smith, call him in 30 days. Did he get his policy? Is he happy with it? Maybe he wants a little bit more coverage. Just hit load and you can pick up right where you left off with him. So we try to make our system as simple to use as possible, while we acknowledge it's not going to replace some of those higher level CRMs that many of you use. So with that said,
and I will add that it is a very simple system to use. I've used a lot of different softwares, and that was another thing that impressed me was the ease of use of the software.
Yep, we try to make sure it's agent centric and that people, anyone using it can be able to understand it. So what we'll do is we'll actually run some cases through the system now. So the first thing I'll acknowledge with the MedSup side, We are launching as of today with 26 carriers. So we have most of the major ones. We're adding as many as we can, as quickly as we can. So GPM, Federal Life, Bankers Fidelity will all go live over the next few weeks, among many others. But when you look through the list here, you'll see most of the major ones that many people use. All of the carriers we have in here are supported for quoting and underwriting, with the exception of United. We have them for just quoting at this time, but we are going to work on getting them in for underwriting as well. If you do purchase us for the FEX side, we pretty much have every relevant carrier at this point. There's one or two. Baltimore Life is going live in a few days and a few others, but in general, we have everything here. And for term, we more or less have the relevant simplified issue products, and we're starting to add a few of the fully underwritten.
And I can turn these on and off, right? If I'm not contracted with any of these companies, I just turn it off in my settings here.
Yep. And the nice thing is, if you're an agency, you even have a separate panel of exclusions at the bottom for your agents, which we'll go into if you want to have that level of customization.
So if I'm an agency, I purchase this, and then I can create sub accounts essentially under me, and then turn on which carriers I want them to see and which ones I don't.
Yep, you can. Most of our agencies actually don't do that. They prefer to pay us nothing, as most people do. So what we do is we create what we call our discount code system. So the agency will have a master account. We'll white label it for them. They set the carriers that show, even the order they want the carriers to show if they want. And then they just give their agents a discount code. And that discount code ties the agents to their account. So the agents pay for themselves. They get a slight discount, but they follow all the rules that the upline or the agency wants them to follow.
Okay.
So what we'll do is we'll run a few cases just to show how we built the system. So the first one, I think, rheumatoid arthritis is something that comes up a lot with Medicare Supplement, or is a tough one at the very least.
Right.
So what we did, so that we don't cut any corners, we'll do methotrexate here. So we'll put it in. You can see we show all the possible indications. We'll put it in for rheumatoid arthritis. We'll say the person's currently taking it, as many people are, and we'll ask you the milligram, because if you're familiar with MedSup underwriting, you know that carriers, it's generally 20, 25 milligrams. Once you go over that per week, a lot of them are going to kick it. So we have that underwriting in here so that it catches, especially for a new agent. They might not think to ask about the milligrams. They might see it on a guide, or they might think it's a heavy med and just throw the app out, or potentially miss out on business. But you can see we have, this is just one example of many things where we try to catch all the possible things we can at the outset. And with that, I'll go over a few of the other features of our toolkit here. So we have the chart here. This is just a basic chart showing you very simply, and you can flip the, for example, your iPad or Surface around and show this to a client, and it even highlights the plan that you have checked. We also have the household discount guidelines. So household discount guidelines are not per plan. Most of the plans vary per state. So you'll have per carrier, maybe 5 or 6 states that have slightly different rules. So we put these right here for you so that you know, especially for a carrier. I don't know off the top of my head. I think.
Yeah, me and Johnny were looking at that feature just a little while ago, just the hover to get the household discount all on the same page, not making any extra clicks or anything. You get both of the prices. So if you realize halfway through the quoting process that, hey, they do qualify for a household discount, you see what it takes to qualify for it, what the percentage is, and you don't have to make any more clicks.
Yeah, so this is a good example here. So Signet in some states has 2 discounts. So we even tell you what you have to do to get the lower and the higher one, because in some cases that could be the difference between getting the sale and not. And either way, you want to get your client the best price that you can. So we definitely make sure to show that on the front end here. We also show some other pertinent information in the what we call the expand menu. So the type of pricing that the policy has, so attained age, issue age, community rated, the AM best ratings for the carriers here, and the effective date for the rate sheet that's the policy is being quoted at. And of course, we have the household discount rates here as well. So we try to give you all the important information that we can in case the client needs anything or you need anything. And of course, I skipped over the policy fee, but that's important as well. And it can vary. It does vary by state for many carriers too. So we include that information for you. With that said, we'll show a few other underwriting cases here. So we are actually the only quoting system. I don't have the zip code off the top of my head, but there's a few zip codes that are in multiple states. We're the only quoting system that will actually show you both the state and the county. Rhode Island, I know it borders Massachusetts with a few zip codes. So as far as I'm aware, we're the only one that will properly quote those zip codes that are cross state. But yeah, so we try not to cut corners. I say all that just because we try to pay attention to detail as much as we can. So for cancer, we'll take a look at this one. So the way our underwriting system works is we try to show as few options as we can at the beginning, and then we walk you down a chain of questioning. This helps to eliminate error, and it makes sure that you're only asking the relevant questions to your client. So we click past cancer here, and then it'll ask us to type. So many carriers care if blood or bone marrow cancers generally are, if ever. So in this case, we'll say it's breast cancer, so we'll just click other. Date of last treatment, we'll say this person was last treated in 2017, so quite a while ago. Then it asks the follow-up question. So have they ever had cancer more than once? Some carriers care about this. We'll say no. Have they ever had metastatic cancer? And we'll say no to this as well. So we try to catch everything we can. And you can see in this case, I don't have a medication. It's always best to enter the medications when you have them. But for cancer, we're probably not going to know what the person was taking 5-6 years ago. So in that case, it asks all the important questions so that we can underwrite it properly. So there's no surprises once you submit the application.
All right. That's another thing that impressed me, was that it's like an intelligent underwriting system, right? It's responding to the information that you're giving it and asking more, subsets of questions beyond just the initial question. And so a lot of the times, that's what you're missing is, you may know that first answer, that first question, but then there's some instances where it's buried in there. And it comes in handy.
Yeah, another good example to that, there's a lot of gray area, especially with med sup underwriting. Final expense in term, there's some, but a good example that one we covered with Justin a lot was nitroglycerin, something where someone's carrying it, but they're not taking it, generally for a heart attack or a cardiac event many years ago. So we have the first fill system where you could say, maybe this client had a heart attack in 2017, and we'll say there's been, this is important too, there's no changes in the medications in the past 2 years. I'll put in a zip code that has a few more carriers, we'll say PA. And when I run this quote, you'll see that some carriers will have the red dot. So it could cause the case to be referred to an underwriter, prepared to put notes. Aetna and many carriers, you have a spot in the app to put some notes. So that can often be the difference too. And Chris can probably attest on the final expense side, there's several carriers where the note is quite literally a difference between the issuance of the policy and potentially a decline or a rating. So we try to encourage agents that with some of these gray area cases, you have to put a note. You have to let them know what's going on, or if you just send it in, it might not get approved the way you want it to get approved. So we try to use this red dot system pretty liberally so that we can communicate different things to the user as well.
That's
so
great.
Underwriting is not just black and white. There's a lot of, you have to know what to do too. And with that, we'll also show the compare feature. So the way we built it, we are going to add multiple carrier compare in the future. However, that's not a huge priority for us, as you can generally compare prices on this page here. So when you're ready to actually quote the client, maybe they're deciding between a plan G and an N and an F, you just hit compare here. We go over to the quote compare tool, and I just pop in, we'll say the 3 most popular in general is F, G, and N. I hit compare, and we're presented with our 3 quotes here. So this can help the client decide between the 3, and we try to encourage, underwriting first, picking the carrier you want to use, and then presenting the client their 3 options. The acronym that I was always taught was keep it simple, stupid. You don't want to confuse the client between, here's a plan N with this company, here's your rate with G with this company, here's an F. It just is, at least the way I was taught, is you want to keep it as simple as possible for the close. So that's our closing.
Yeah.
That's my favorite part.
I was gonna say Johnny was really digging that part of it.
Yeah,
the
part for sure.
3 plan.
It's just really, really convenient. I mean, for me, the way I sell it's very, very helpful for sure.
Yep, we try to encourage the simplest and most effective way to sell as we can, and that's what successful agents use. So that's what we build in, and we do have our excluded carriers here. So the rule that we did when we were building this, especially on the med sup side, is if there's a 95% plus chance it's not going to go, we're going to exclude it. So we expect some argument on certain things, but in general, we want to show the result that you can reliably expect to be approved or rated in the way that we are showing. So just keep that in mind as you're using the software as well. We don't support any questions, but we try to show you what's going to be reliable, not what might be a pie in the sky chance of going through.
Yeah.
So
we take a pretty conservative approach at that too. I remember when we built out a lot of the data, we'd be on the phone with the underwriter, we'd be on the phone with our guides, and we'd be talking about it. And we would say, what is the most conservative answer to this 95% of the time? So there was a lot of thought that was put into these results that come up. It's not just, data being pulled from the cloud without any human input involved.
Yeah, definitely true. And we do have the class ratings, and I'm not going to show this because many of you know how it works, but if you put in the height for, Moo and, Medico, certain carriers, we do have the class ratings in there. So I believe we're also one of the only quoting systems that have the height weight right here. So you can just pop it in, even if you don't want the.
And that's huge for new guys, right? Because a lot of them are they don't want to take the time to remember which carriers are going to rate me up for height weight. And so if you're just recording that information, most likely during your fact finding, you're probably already gathering that information, hopefully, right? And so just put it in there. And now you're going to save yourself some headaches from, getting halfway through an app or starting down into a carrier portal and just to hit a brick wall. So.
Yeah, I believe on medical, the highest class rating, I believe, is 25%. So you can go pretty high. So if you don't catch that at the beginning, you're probably not going to get the sale if you're almost at the end of the app. And
right.
You have to surprise the client with a 25% premium increase. So it's important to collect that here. And the last few things I'll show, we do have the cheat sheet built in. So this is something where it kind of shows you our back end. So I'll put cancer as an example here. So we'll pretty much show you the carriers that we have in the system, and then it'll show you the rules so that you can quickly reference the companies that you have turned on. We also have the drug lookup tool if you want to look up one or two medications quickly. Most of our users use the quoter itself, but this is here too if you want to look up one or two medications. And we do have a few extra tools for agents in the settings page here. So if you have a website and you want to do some generic lead collection, you can do so here. We do have the TCPA compliant wording here, and you can just paste this code right into your website. The leads get delivered securely to your CRM. Now, this isn't the fanciest lead generation tool that exists, but it's free. We're just giving it to you, and we do plan to improve on it over time. And this is the light link. This is something that's very popular with our users, especially our mobile app. At this time, it's about 2 weeks away from supporting MedSup. Right now, it's just specs and term. You can use the website version of the software on your phone, but the light link here is shareable. So I'm going to open a new tab here and share this tab. So when I paste in the light link, and I'll resize the screen here to be what my phone would be, you can paste this into your favorite web browser, bookmark it, and it allows you to quickly run a quote without needing to log in or open any kind of special link. And there's no underwriting on this link, but it's very quick, and it shows you the pertinent information as it pertains to the company.
Right, just a quick quoter, pretty much. Yeah.
Mm-hmm.
Yep. So it's a shareable link too. So if you have an agent who doesn't have the toolkit, you can send it to them. You can post it in the group chat. This is just a free tool that you can share it around as you please, and it has the carriers on it that you want to show. So that's the light link, and we have one for effects, term, and MedSup, all three. So that is that's basically the tool. We try to keep it pretty simple. We have everything in one place, and we're always looking to improve it the best we can.
Well,
that's
like I said,
awesome.
We've got some of our guys using it, and we have some newer guys, so it's helped already. Of course, you just loaded a lot of extra carriers in there, but the core carrier that we write a lot of has been in there for the past few weeks or months now, I guess. And we've been getting a lot of feedback from our guys that have been loving it, and it looks like you've added some more since this.
Mm-hmm.
That's what I think too.
In the last couple of days, so it's super exciting. Like I said, it's a revolutionary tool. I know that it's something that I was telling Justin that if this could be created, it's a game changer for the agent, right? And so you guys have done all the legwork. You guys have done all the hard stuff. And so what is the cost of Insurance Toolkits?
Yep. So we'll head over to the pricing page here. So remember, before I go over this, Justin's discount is MC Gurus 15. I think that's in the chat on the left, or the other box. But we have two categories of plans. So if you have an agency and you want to pay for your agents, we have these plans here. If you want to do the discount code method that I mentioned, which is pretty much our most popular way of doing these agency accounts, you can contact us and we'll help you. But this is the price to pay for the agent. So it's $119.99 if you want just the MedSup, and you can add on accounts at $29.99 per account per month. If you want to bill your agents on your own outside of what we bill you, that's fine with us, but that's the price that we bill with one point of contact. For most people, it's going to be the individual plans. So we have the just Fex and term, just MedSup, and then both here. So if you get both, it's about, I think, 35% discounted, and that's before Justin's discount code, which will bring it down to $49.79, I believe. So this gives you both or all three toolkits, not just the one or the two.
So I can get FEX, term, MedSup toolkits with the MC Gurus promo code, MC Gurus 15 promo code. Make sure you use that at checkout, and that brings it down to
$49.79 a month. Yep.
$49.79. So for $50, you can get this software. And if you don't make more than $50 a month,
that's what I was just sitting here thinking. I was like, I was sitting here thinking, like, if you're an agent who has banged people's lines, writing MedSups, rewriting MedSups, underwriting, dealing with that, and you don't see the value in that, and I don't know, I need to talk to you, because that's it's even if it's just the med sub one, it's $39.99. Is that what it was?
Yeah,
$39.99 for the med sub tool. If you're I mean, it's like I said at the very beginning, time is money. And when you really, really do this stuff a lot, Chris can vouch for this.
Absolutely.
Over time, a whole week, for example, these tiny moments that you're going to find out pieces of information, the more you simplify that and the more that you make your process efficient, the more money you're going to make. And that's just the fact of the matter.
If it helps you add one policy over the course of the year, it's paid for itself. Like one policy that would have been declined, but your head wasn't right in the game at that moment. You checked the cheat sheet, so you placed it the right way. If it gives you the confidence to look at things one different direction, you just have to sell one extra policy, and the whole thing's free. Like the whole, how much does this cost is almost irrelevant because you're going to make money by using this program. On the final expense side, we've had massive agencies see significant improvement on their placement ratios. We've seen new agents be able to get out there and be confident without sitting at home and studying agent guides. They just went out, plugged it in a toolkit, and wrote the policy. Exactly. Like this thing's free. Like the money part is just
it's a non-issue, really. You all make a lot of money.
Yeah, well,
if you're listening to this, you're making good money.
Yeah, well, even the brand new guy that's never sold a policy, I think this gives, like Chris was just saying, that gives him the power, because I think that's the limitation when you first get started is you're scared to go out there because you don't know everything. Well, you don't have to know everything with this. I have a tool that's going to pretty much narrow it down and give me the path that I need to take.
Yeah,
it's taking the thinking out of it, and I'm all about taking the thinking out of it.
Yeah, me too.
So
I don't like thinking about nothing except.
I love it this way. We did all the thinking for you. Before you would think, now I'm just becoming a drone. We've done all of this for you. We've spent months, almost 6 months of effort into this tool. It's accurate. It's correct. We wouldn't be putting something out there that we wouldn't feel comfortable using. You don't have to do the thinking because we've put the time and effort in there for you.
Absolutely. And these guys know what they're doing. As you can tell just by listening to Joe, like he is thorough and he thinks about, all the possibilities and covering it. Just the example that he was given about meeting the county line and different counties being that close, right? Like that is the detail that they're paying attention to. So I know that, me and Justin spent some hours with him on some calls going over this, and he is a wizard when it comes to all these sheets and working all this stuff out, man. So he's kudos to you guys. I know it takes a lot of work. I have some coding development and things, and like I said, I've had this idea before, but I'm glad that I didn't have to tackle it and you guys did. So I'm thankful.
Well, he would have, but you guys came in before he got tired of dealing with Medsup underwriting.
Yeah, so we're happy to partner with you guys, and it's the tool that we've got all of our teams using. We got a brand new guy that just started this week. We've got him using the tool, and I mean, the price, it's a no-brainer, guys. So go check it out.
Well, you get 15% off too with
another
code,
neat thing that Joe didn't even touch on was, I don't know, you guys probably seen it in there though, but it was the fact that it said e-app, and you can just
go
click
right to
on
the thing.
You click on e-app and it takes you directly to the carrier's login portal.
So it's even got bookmarks in it.
It's not allowing you to submit the application through the software, but
not at this time.
Yeah,
not yet.
It's a shortcut directly to your carrier portal. Joe, I don't know. Yeah, I was gonna say if you could just pull that up, because I thought that was pretty neat, right? Like, because a lot of the times, especially brand new agents, they're all out of sorts and they don't never get their bookmark straight, or maybe your upline doesn't tell you that I need to bookmark all these carrier portals as I'm setting it up, and so if you didn't do that, you're in luck, right? Like here it is for you. It's a simple shortcut straight to your favorite carrier. Boom. Hopefully you've got your login information saved, and now you're just logging in. So
you could literally just use this in the beginning for everything.
Mm-hmm. Yeah,
you really can. If you don't have a lot of money and you're like, oh, I got to get my systems and processes in place. Here's your systems and processes. Now go write business.
Yep.
Mm-hmm.
Buy leads, use insurance toolkits.
Stop thinking, just do.
Just go pick up the phone.
I mean, honestly, it is as simple as that, right? Buy you some leads, buy Insurance Toolkits.
There's a guy that I'm talking to right now who
in front of some people.
He just bought a bunch of age leads, and he's actually doing well. It costs like $125, and he's already closed one Medsup, and I'm like, paid for itself right there. Like, just do that a bunch. So people write business and use Insurance Toolkits.
That's it.
That's all you have to do. They'll even catch the things. I think I forgot to mention this one, but if you have agents, they're not going to know that gabapentin and metformin indicates diabetic neuropathy. So things like that, if you can catch one case, 99% of agents fail within 5 years. If you can catch one more agent, turn it into a Chris Smith, I think that's, probably will pay for itself 100 times over. So
Absolutely.
Yeah, because there's a lot of different situations like that where drugs are associated with certain diagnosis, and they, no matter whether they're taking it for that or not, because you'll have your client that argue with you. No, I've been taking that long before I was diabetic. I've been taking gabapentin for my restless legs for years, right? But I'm sorry, the underwriter that gets this is going to look at this as associated with your diabetes. So and again, in the beginning, you don't know all that. This is telling you that, it's flagging it for you. So
I'll tell you a quick moment here. Before I got in the insurance business, I spent 10 years as a paramedic. So I knew everything about medicine, but I didn't know anything about selling. I couldn't even warm up with people. I didn't know what to say. I just knew what they took these medications for. But on the flip side, so many people get into this business and don't know anything about the medications on the screen. So not only have we built this with years of insurance experience, I've had years of giving these medications to people. So we looked at it from both angles to make sure that you don't need to know these combinations. We've known them for you. And when Miss Betty says she takes Namenda for her bellyache, it's not true. She takes it for dementia. There's no reason to argue about that.
Yeah.
That's actually one of our most popular support chats, is agents getting mad at us because we put donepezil. If you put it in the computer, in the system, it only comes up obviously for dementia.
That's what it's going to be declinable
every time.
I don't even.
We don't list confusion here because they might be confused.
They are confused.
Dementia, but they're not taking it.
The alternative to that when you're writing a Medicare supplement is, okay, go to your doctor and get a written statement that you're taking this, not for that. And how many people are going to go through this process? Like Miss Betty's 85. She doesn't want to go through that, right?
Right.
I'm just going to avoid all the headaches and put her with a carrier that I know will accept her in the beginning.
Yeah. I was actually thinking about, so I focus heavily on MAPDs, and I think that MAPD agents, and one of the reasons they like doing it is for the ease of no underwriting. And if you like writing med subs and you've only written med subs, then this is a slam dunk to, because I mean, if I don't know if everybody agrees with me here, but people focusing heavily on MAPDs versus people focus heavily on med subs, MAPDs, clearly those agents write a lot more apps, right? A lot more MAPDs because there's a lot less time that goes into it. It's just like, okay, is this the best thing for you? Great. It's all in one platform most of the time too. So here's a perfect opportunity to grab a platform that's going to centralize it and make you be able to really do everything in one little place. So it's going to help a lot of agents get those numbers up. So that's cool.
Yeah, guys. So if you're late to the show, we're with co-founder of Insurance Toolkits, Joe Wahl, joined by an agent and right-hand man of Joe right there working with them inside of the Insurance Toolkits, fine-tuning these things, Chris Smith. And so we appreciate them for joining us today. Guys, thank you for taking the time out and showing us, giving us a little demo of it. And if you missed it, use the promo code MCGurus15 when you go to checkout at Insurance Toolkits. That'll get it down to about $49.97, I think Joe said.
Combined, but if you just want the med stuff, it's only $33 and change. So
wow.
Well,
so actually,
even better.
A half or a quarter, a third of a cancer policy. Let's roll, guys. Come on.
You got to sell one.
A half a cancer policy.
Yeah, I think you
could
guys
split a cancer policy with me and it'd still pay for it.
Yeah, I mean, I think you all can do it. It's a no-brainer, guys. So appreciate you guys joining us. That's all we got for today. Thank you for this edition of the Insurance Gurus podcast. Head over to Insurance Toolkits, and we'll see you guys next time.
Come on.
Thank you.
Insurance Toolkits is the premier platform for effectively quoting final expense, simplified issue term life, and Medicare Supplement policies. That's right. The intuitive underwriting software eliminates potential declines and provides accurate quoting for dozens of carriers. Medicare Supplement underwriting is one of the most difficult things we have to teach a new agent. Visit InsuranceToolKitscom to start your free 14-day trial today.